Hi, my name is Jean and I'm a student physical therapist assistant, and today we're going to do a manual muscle skill check of the neck and trunk. And my patient today is Nicole, and I'll demonstrate what a grade 5 is, which is normal, and then a grade 2, which is poor. And now we're going to demonstrate a cervical flexion manual muscle test grade 5. And Nicole, this is the motion I want you to do. And now I want to see if you can do that. Good. And now I'm going to have you come right like that and hold it and don't let me push you down. 1, 2, 3. Good. And you can relax. And I'll give you a grade 5 because you were able to hold my maximum resistance. And now I'm going to demonstrate what a grade 2, which is poor, looks like. And that means they're not able to complete partial range of motion. So, Nicole, this is the motion I want you to do. I want you to come to your right, and then to your left. And then when you come to your right, just see if you can do that. Good. And I'll give Nicole a grade 2 because she was able to do that partial range of motion. And now we're going to be performing a cervical extension manual muscle test, a grade 5, hopefully. And so Nicole, this is the motion I want you to do. And now I want to see if you can do that. Great. And go ahead, come back to neutral, and don't let me push your head down. Great. And I will give Nicole a grade 5 because she was able to hold maximal resistance. And now Nicole, I'll have you go on your back. And now we're going to be testing for a grade 2. And with this test, I'm going to place my hands underneath Nicole's neck, palpating for the extensor muscles of the cervical extensors. And now I want you to tilt your chin and look at the ceiling. Good. And I'll give you a grade 2 because you were able to do that with partial range of motion and out of gravity. Next, we are going to be doing a cervical rotation. And so Nicole, this is the motion I want you to do. And now can you do that? And good. And come back to your left. Good. And don't let me bring you to the right. Good, and you can relax and come back to your right, and don't let me bring you to your left. Good. And I will give that a grade 5 because Nicole was able to hold my maximum resistance without moving. And now we're going to demonstrate a grade 2, and could you just rotate your head? Good. And I will give that a grade 2 because Nicole was able to perform partial range of motion. And now we're going to be demonstrating a manual muscle test for the trunk, and we're going to start with trunk flexion. And we're going to demonstrate a grade 3. So Nicole, what I want you to do is extend your arms above your body and go ahead and lift your trunk. And I'm feeling to see if she can clear her inferior angle of the scapula, and she did, and you can relax. And now we're going to demonstrate a grade 5 trunk flexion manual muscle test. So Nicole, what I want you to do is bring your hands behind your head, keep your elbows straight, and flex your trunk upwards. And I'm just checking for that inferior angle of the scapula, and she was able to do that, and so that is a grade 5. A grade 2 is I need your arms at your side. And what I want you to do is I want to see if you can lift your head up. Good. And at the same time, when you lift your head up, I need you to cough, and I'm just going to palpate for your abdominal muscles. And so go ahead, lift your head up and cough at the same time. And you can relax. And she did have some palpable abdominal muscles, so that would be a grade 2. So now we're going to demonstrate a grade 3 trunk rotation. And so, Nicole, I need your arms above you, above your body, and go ahead and rotate to your left. And I'm looking to see if she's cleared her scapula, and she did. And go ahead and relax. And now with the same motion, come to your right. And she clears that scapula, and you can go ahead and relax. So we'll give that a grade 3. A grade 4 is she would cross her arms. And now we're going to demonstrate a grade 5 with your arms behind your head, keeping your elbows straight in back of you. And now go ahead and rotate to your left. Again, clearing that scapula, good. Relax and rotate to your left. Clearing the scapula, and I'll give that a grade 5. So now we are going to be doing a grade 2 for trunk rotation. So I just want your arms above you, and now bring your left arm to your right knee. Okay, and I'm going to give Nicole on that side a grade 2 because she doesn't clear her inferior angle of the scapula. And we'll go to your bringing this both arms up, and bring your right side, right shoulder to your left knee. Again, she doesn't clear her, and you can relax. She doesn't clear her right inferior angle of the scapula, so we'll give that a grade 2 for trunk rotation. So now we're going to be demonstrating a grade 3 for trunk, lumbar, and thoracic extension. On your skill check, you'll want to start with a grade 3 first to make sure your patient's able to move from there. So Nicole, what I want you to do is come to the edge of the plinth, clearing your chest, and that looks good. And then I want you to keep your arms to the side, good. And I'm going to stabilize you at the ankles. And now what I want you to do is lift off the plinth with your trunk, neck, and arms. Great. And I'll give you a grade 3 because you were able to do that. And now you can relax. So now Nicole and I are going to demonstrate a manual muscle test, grade 5 of the thoracic spine. So Nicole, what I want you to do is come off the table with clearing your chest and your hands behind your head, and go down, and now come up. Great. And that's a grade 5 because she was able to come up to the table. And now we're going to be demonstrating a grade 5 for a lumbar 5 extension of the trunk. So Nicole, what I want you to do is place your hands behind your head. I'm going to stabilize at the ankles. If she has strong hip extensors. And now I want you to bring your trunk, arms, and head off the table. Good, and you can relax. And we'll give that a grade 5 because Nicole was able to do that without much effort. And now Nicole and I are going to be demonstrating a grade 2 manual muscle test for lumbar extension with thoracic extension. So if your patient wasn't able to perform a grade 3 of that previously, we're going to go on to a grade 2. So Nicole, what I need you to do is keep your hands to the side here, and then I'm going to stabilize your ankles, and I'm going to palpate your trunk extensors and see if you can come off the plinth. Okay, great, and you can relax. And I would give Nicole a grade 2 because she was able to complete partial range of motion of her trunk extensors. And so now, Nicole, what I want you to do is show me this motion. Good. And now you do that. Good. And now let's do that one more time. And don't let me pull you down. And you can relax. And I'll give that a grade 5 because she was able to hold with maximal resistance. And now we're going to demonstrate a grade 2. So Nicole, I just want to show you the motion I want you to do. And now can you do that? Okay, and can you do that one more time? Okay. And I'm going to give you a grade 2 because you were only able to complete partial range of motion. Okay, Nicole, I will let the PT know the results of your neck and manual muscle test and of your neck and trunk. And then do you have your next PT appointment set up?
Yep.
Okay, great.